I'm good. I'm good. Okay.
So,
Yeah, and I know Dan needs to get out too.
we're talking about the people, the speaker goes to about one,
Okay.
so that they can get over.
So you need a pantry, okay. It's a good idea. Used to be 10 o'clock, but it's pushed forward.
Well, usually at 2 o'clock, but Deacon Mario,
Thank you.
Deacon Mario gets down probably about 20.
Okay.
And when he's done, people get their feet.
Yeah, he gives the blessing.
321 Road.
It's, do you know where the old San Mutual building was?
She's been,
Oh, yeah, that's right, you go
she's
there.
been down there many times.
Yeah.
One time she was in there, she had 3 interviews.
Oh, wow.
Yeah.
Why don't we get started since we want to get in?
Sure.
All right, well, I guess we'll try to get started now because we're going to try to end about 10 minutes early, about 9:40, so that you guys can get over to the pantry as early as possible. But first off, I want to thank you for coming. I also want to let you know that I'm going to be kind of retiring and walking out to the hayfield from Roadmap and Worship Interfaith. I'll always be here to help the organization, but things are getting busy in my own life with health issues and my wife's health issues. So, now's a good time to move on. But the group is about 8 years, and we're now a 501c3 nonprofit, and we have a lot of structures in place and programs in place. But what I really wanted to do, thank you guys, because without you guys coming, we wouldn't have a program. We're also making slight changes to our clothes bank, where we're going to go to a voucher system. We're going to give you cards with money on it that you'll be able to use at the new thrift store in Horsham called Worthwhile. It's over in the Acme Shopping Center, Glenville Road. I believe that will be going forward. So it won't be the third Saturday of every month like it has been in the past.
So you can go anytime it's open is what you're saying? So you can go anytime it's open?
Yeah, it can go anytime it's open. It'll have a much wider range of sizes from, extra small to extra large. We don't have a spot to really store the clothes. So we've got our fingers crossed that it's going to help more people and you'll get more things that can be of value to you. So that will be. But really what I wanted to do and publicly acknowledge Bill Gallagher, because without his persistence, Horsham Interfaith wouldn't be around. He asked me to help him years ago, and I was used to helping him from being in St. Vincent de Paul Food Pantry. And he's just a phenomenal guy. And without his persistence and vision, none of this would be possible. Our Roadmap Life Skills class, our clothes bank, and the pantry. I remember when we first got involved, we used to go to Chutton Baptist Church on Langdon Pike and Drescher. We didn't even have a food pantry. They let us use our extra stuff on Saturdays. So this guy is amazing, and he's going to help pull things forward. We're also gonna help out. Teresa Brown and Dan Gargle are gonna take over the scheduling of speakers. We're very lucky, Teresa and Dan both help out at both the clothes bank and the food pantry. So you're in good hands. I have gotten more out of this than all of you have, okay? And that's part of life. When we volunteer, we get more than we give. And I think that's something that all of us can remember as we go forward. You know, sometimes we think we have it hard, but we're pretty lucky in life. We have what we have. And, you know, being kind and sharing that with other people really goes a long way. Also, at this point, I want to thank Matt. Matt does our newsletters. I was so insistent on getting emails because as we go forward, Matt will be sending emails to all of you guys, in addition to our volunteers and our donors. And, you know, so Matt has done a tremendous job getting our newsletter together. And also Matt videotapes these, and then they go on the website so that people can look at past you know, speakers. At this time, I'd like to introduce Tom Wand. Tom is local. He's right here from the Springhouse area. Tom is a volunteer for a group called Retired Senior Volunteer Program, and specifically a group in the state of Pennsylvania called PA-MEDI. Tom is going to talk about Medicare, Medicaid, Part B, Part D, things like that. So we're very lucky to have somebody like this. If you're on Part B and you have to choose, if you're on Part D and you have to choose a prescription plan, they can help you. You put your own prescriptions in there and it'll shoot out what's the best plan to join. So Tom, I don't believe sells insurance. He's gonna just hold all of our hands and teach us how to make a better choice, whether it be traditional Medicare, whether it be Medicare Advantage, or whether it be the Part D prescription plans. And I'm sure you guys have other programs that I'm not so aware of that you can let us know. So, okay. Tom, thank you for being here.
I think we should all stand up.
Yeah. There we go. That works every time, I'll tell you. All right. Tom, it's all yours.
Okay. You should have a packet of papers in front of you. What that packet of papers is every slide that I'm going to show you. Okay? That's your personal copy. Write on it. You know, take up whatever you want. It's yours to keep. Okay? There's also a card. And on the card is a phone number with an extension. Now, did everybody get both of those?
I have it.
You, yeah, okay. Is anybody without it? Okay. We're going to talk about first, what is the organization that I volunteer with? It's the Commonwealth of Pennsylvania's State Health Insurance Assistance Program, known as a SHIP. There is a SHIP everywhere the American flag flies, okay? All states and territories. And we are the one for Pennsylvania. We're supported by federal and state funds, the lottery. Basically, these are services are provided through the Area Agency on Aging. which, for us is the county aging department, but they have contracted with RSVP to run the program, okay? So that's why when we call you, it will say RSVP on the little caller ID, okay? We are trained volunteers. They, you know, I emphasize trained because people who are volunteer and think, oh, they just said, hey, why don't you go mess with people's Medicare? No, they train us how to do this. And what we do is we do educational events like this, and one-on-one, we help you, and I'm talking not just to you, but some of your relatives and friends, help you make the correct choice, the best choice for you. We do not sell anything. We have no financial interest in the choice you make. That makes us different from agents and brokers. You may get mail or phone calls from them who want you to patronize their business. We have no, we don't care whether you pick the Cadillac plan or the Hyundai plan or whatever. We are here to help you. Now, this is, we help with Medicare. We sort of touch on Medicaid as it affects Medicare. Let's go over the difference. Medicare is a program run by the federal government that is for two groups of people. People 65 and older. You are eligible for Medicare when you hit 65. It has no connection with when you decide to take Social Security benefits. You can do that, I think, 62 to 70. But Medicare becomes eligible for you when you turn 65. If you are receiving Social Security benefits, it's automatic. You get a Medicare card in the mail.
You don't have to take Medicare though if you work for an employer.
Okay. Yeah.
Who offers a
That-
medical plan, and you have 200 or more employees or something.
Yeah, we're getting to that.
Okay.
Okay. If you are working for an employer with 20 or more
Yeah, it's 20 or
employees,
more, okay.
20 or more employees, then you can put off taking Medicare while you're covered by insurance. It comes from either you're working or your spouse is working. For active employment, that means COBRA doesn't count, okay? Which is something where you continue your benefits, but you pay for them after you finish working, okay? That doesn't count in terms of putting off the deadline for signing up for Medicare. We can help when the insurance companies that you buy coverage from to add to Medicare are giving you a hard time, okay? We can help with appeals. As I said, we touch on Medicaid, but that's not the focus of what we do. You can either come in to have a session one-on-one, and that number that's on the card, you call that up, we call you back, we can talk with you about where you are and where the places are. Or you can do it over the phone. You know, I staff the phone part of the week. The number that is on that is essentially an answering machine. You know, you leave your name, your phone number, and it doesn't ask for this, but it's really, really helpful if you tell when is a good time to call you back, okay? If you're available certain hours and not available certain hours, let us know, and that gives us a better chance to connect with
Do
you.
you actually apply for people for Medicare? Do you actually do the applying?
We can help. Particularly, applying for Medicare is something that can be done all online. So you don't have to go to the Social Security office to do that. Now, as I say, it's totally separate from your decision about when you start to get Social Security benefits. However, just to confuse you, if you go on the place you apply, you can apply. It's a Social Security website, so we just do that to mess you up. Okay? So, Medicare is for two groups of people, those who are 65 and older, and those who have been on Social Security disability for over 2 years. On your 25th month of being on Social Security disability, you are automatically enrolled in Medicare, and that drastically changes your Medicaid, if you all saw that. Medicare is 65 and over, been on Social Security disability for over 2 years. Medicaid is for people with low income and low assets. Okay, it's a state-run policy run out of the county assistance office. Now, does anybody here live in a county other than Montgomery County?
Bucks.
Bucks, okay. So, I'm gonna talk, but you're gonna have to call the CHIP, PA Medi in Bucks County. And the reason for that is that the options you have vary slightly county to county to county, okay? So, people under 65, if you have end-stage renal disease, you're on immediately. If you have ALS, you're on immediately. Other disabilities, and again, that goes to the 2 year. You must be a US citizen or a legal immigrant for at least 5 years. And it will come as no surprise that do you need another set of stuff there? Okay. It would come as no surprise that presently they're tightening up on that a lot, okay? Medicare is not the same as Medicaid. If you do nothing else today, get those separate in your mind. Medicare, you know, is for these folks. Medicaid is for anybody regardless of age who has low income and low assets. Okay, Medicare has 4 parts. Part A is hospital insurance. If you're working, you will notice on your pay stub that there's a little bit taken out for Medicare insurance. That's what pays for if you have enough credits in Social Security that your Part A has no premium, okay? That's for hospitals, inpatient, stuff, you know, where you're in a hospital and you're classified as an inpatient. Always find out if you're an inpatient or not when you're in the hospital. And that has a fairly sizable deductible, but then it helps pay for the costs of being in the hospital, which are astronomical, okay? Part B is outpatient. Your doctor's visits. You have a test, you know, an MRI or CAT scan or something like that. That is paid for with Part B. That has a deductible and a 20% copay. Now the good news is that those are based on the Medicare approved amount for the services you render. Let me okay. And that's really important that it's based on that. My own doctor, my primary care physician, when I go see her, she bills Medicare for $370 for a visit.
They're like 15, yeah.
And Medicare says, that's very interesting, we'll give you like 110, okay? It's really funny to see how much each provider is willing to have a huge retail price, but Medicare pays. And so what I would pay, had I no other insurance, would be 20% of that, $100 and some, okay? What is also true is that doctors can charge up to 15% more than the Medicare approved rate. And you would have to pay that, except for the fact that in Pennsylvania, we have a law that prohibits that. So if your provider is in Pennsylvania, you don't have to worry about that. However, in every state that touches Pennsylvania, that would be something you'd want to make sure of for it. So if you are down the shore for the day and you see a doctor down there, then that could happen. New Jersey doesn't have that law. Now, Part C is Medicare Advantage. If at this time of year, your mailbox is filling up with stuff from insurance companies, mostly they're trying to get you into Medicare Advantage, which is a plan where you get your services through an insurance company. They get some money from the government, they may have a premium from you, they have a whole new set of co-pays and deductibles, and what they believe is they can offer everything Medicare offers with the deductibles and co-pays that you'll pay, and they can, take care of you and still make money, okay? Medicare Advantage plans change every year. You know, just because you have the, you know, Humana super duper Medicare Advantage plan, and next year they're offering the Medicare super duper Advantage, Humana super duper Advantage plan. It, you know, it's the same box on the outside, but it may not have the same contents inside.
Are you gonna show us the Swiss cheese and holes in it, like a commercial for the matter?
Yeah. Then there's Part D. If you're on Medicare, you need to sign up for Part B, boy, and Part D, dog. Actually, Part D is the only one that makes sense, D, drugs, a prescription drug plan. You can't do I don't take any prescription drugs, I don't need to sign up for insurance. That doesn't work, and when you do sign up for a prescription drug plan, you'll have a penalty. So you want to sign up for those when it happens. Now, a number of you are looking like turning 65 is pretty far away in the future, but you have friends and relatives whom it's a lot closer. Also, as I keep looking at t-shirts that are offered in catalogs that say, I thought getting old would take longer. It comes up actually pretty fast. Okay, hospital stays. Doesn't cover TV, telephone, or an upcharge for a private room, okay? If you have had 3 midnights in the hospital, then your rehab in a skilled nursing facility, also called nursing homes, but you know, skilled nursing facility, then then they will cover that. They do not cover what's called custodial care. Okay, once you've gotten as rehab as you're gonna be, then if you are still in a skilled nursing facility, Medicare stops paying. That, you know, there is long-term care insurance, that's what that's for, but that's really hard to get and really expensive these days. Part A covers hospice for people with that have a condition that overall, on average, means somebody lives less than 6 months. However, when you go on hospice, you're not required to die at the end of 6 months. I worked 7 years for hospice, and you know, people, you know, families put loved ones on hospice way too late. What happens with hospice is if your doctor says you're eligible, all of a sudden you get a whole lot more support and services from hospice than you had before. And people go on and off of hospice, you know, because what happens is all of a sudden the patient is getting all these extra services, plus the staff at whatever facility they are, or they're the ones who visit their home, know that somebody is going to be in several times a week seeing how the services they're offered from other people are provided, if they're done well or not. So all of a sudden, the level of services they get from other providers tends to rise up. And so they get better, and we have to kick them off of hospice. But then later on, they go back, hospice, people ought to think about hospice a lot earlier than they do. I'm sorry, it's not really part of my talk today, but I get up on my soapbox. Some home health care is covered under Part A if you're discharged to home rather than a skilled nursing facility. Part B, outpatient medical, preventive care. There's a whole lot of preventive care that if you're on Medicare, no matter what plan you have to get that without a copay. That includes an annual wellness visit, includes pap test, pelvic exam for women, screenings, and a lot of the shots that you need. You can read the rest of it on your durable medical equipment, hospital beds, prescription drug coverage. If you have a Medicare Advantage plan, Part C, that will be part of the package, that you have to take the prescription drug plan that goes with that Medicare Advantage plan. If you don't have Medicare Advantage plan, then you can get a standalone Part D plan. And that's something you want to take a look at every year, because they change, your needs change, and again, if you know somebody who says, I don't need to sign up for that because I'm not taking any medications right now, that doesn't work. That comes back to bite you, okay? A lot of vaccinations are not covered by Medicare Part B are covered by your Part D plan. Okay. Part D coverage is, there's a deductible in some plans, there's not in others. We can help you figure out what's the best plan for you. It's really good. At the end, I'm going to talk about a website, Medicare.gov, and if you have access to a computer, either you have one or you have you can access one at the library. You can do a lot of good work on that. Okay, you can you can find your own best Part D plan. So you have a deductible phase and an initial coverage phase. You pay a percentage, and that depends on which one you choose. And then and this is a new law that just took effect last year. When you reach your personal limit, this year it's $2,100, that you or your plan are paying out for you. Then after that, you enter the catastrophic phase, in which case your co-pays are zero for the rest of the year. So remember that Part D this Part D part doesn't apply to drugs you receive in the hospital, which are generally covered by Parts A or B. Okay, up The limit is up from 2,100 from 2,000 last year. Sometimes if you're on drugs that have been around for a while, generics are available, the drug plan will divide drugs into various tiers. Cheapest are tier 1, next cheapest are tier 2, then 3, 4, 5. 5 are real expensive. A lot of times, plans don't charge the deductible if you're getting just the cheaper drugs, tier 1 and 2, that have been around for a while. That's one of the things that I know saves me money, is that my doctor tends to prescribe not the stuff you see advertised on TV, but drugs that have been around for a while. Now, you can enroll in a program, you know, if you're in a program, if you're in a plan that has, say, a $615 deductible, in January, if you're paying what is essentially full price for your medications, that may be more than you have in your petty cash drawer, okay? But you can enroll in a plan that will take your projected medication costs and spread it evenly over 12 months. It's sort of like what PICO does, you know, with their budget plan, okay? Okay, we've got Part D drugs being negotiated, you know. First there were 10, this year there are 20 more of the most commonly prescribed drugs that Medicare is allowed to negotiate with insurance companies to bring down the price. And what they've done this year is pretty spectacular. So, and if you have a Medicare Advantage plan and it has a program or one of the side benefits that you're not using, in the middle of the year you get a reminder, did you know that your plan has a transportation provision that can get you free rides to a certain number of free rides to and from the doctor, okay? Here's an example. You know, Farxiga, they advertise a lot on TV. $556, you know, was list price, $178.50, the new list price. Prices are going way down on drugs that Medicare is allowed to negotiate on. So these are 10, 20 more in this year. Okay. There are 12 plans available, 2 less than last year. Those are the 2 that went away. If you or your friends or relatives are on one of those, they've got a chance during open enrollment to choose a different one. If you don't do anything, if you've got these plans, the insurance company will assign you to another plan. They may not be as careful about saving you money as you would be. So always be proactive. Take a look, let us help or, go on, if you and computers are friends, you know, or you have a 10-year-old granddaughter, you know, you can, go on and find the best plan for yourself. Now, these are all the plans. This is the cheapest one, $660 a month. This is the most expensive one. What's the right one for you depends not only on the premium, but on the co-pays. And one of the things that Medicare.gov or us helping you does is find the plan with the lowest total cost to you, including premium, deductible, co-pays, okay? So we put in all the medications you take and, you know, press the magic button, bada bing, all of a sudden, it tells us which is the plan that has the lowest cost to you. Okay? Medicare prescription payment plan. You opt in through the plan that you've chosen. Okay, here's a list of what Medicare doesn't cover. This is a biggie. Custodial care in a facility does not cover that. Generally, stuff outside the US. So, if you're gonna take a vacation in Canada, make sure you're healthy, okay? Always routine dental and vision. Always say one of the things to remember is if it's a hole in your head, Medicare doesn't cover it. No eyeglasses, no hearing aids, no dental. Now, a Medicare Advantage plan may have some benefits for each of those. So if you know you're gonna have a big need, then you might want to check those out. Okay. Monthly premium is, for Part A, is generally zero if you have a history of working and, you know, and Social Security and Medicare taxes being taken out of your pay. The deductible, when you go into the hospital, it is $1,716. And that can happen to you up to 5 times in a year. What happens is you go into the hospital for, you know, you need your appendix taken out. $1,716, the first $1,716, Medicare doesn't cover. Now, if you know anything about hospitals, $1,716 will cover about the first 10 minutes of your being there, okay? And then, okay, get your appendix out, you may go to rehab, you're back, you're fine. 59 days later, after your first admission to the hospital, all of a sudden, you have some other reason to go to the hospital. You have something going on with your foot, okay? You need to go to the hospital. You're admitted, no new deductible, because you're in the same benefit period. However, if you have to go into the hospital for your foot treatment after having your appendix out, and it's 61 days after the original admission, new benefit period, new deductible. If you time your medical needs particularly poorly, you can get up to about 5 of those in a year. So that's why people buy, when they can buy insurance to cover that. Here's the cost sharing for when you're inpatient in a hospital. $0 for days 1 to 60. Almost nobody's in the hospital 60 days these days. Okay, then Part B, outpatient, has a monthly premium for 2026 is $206.50. If you are receiving Social Security benefits, that will be taken out of your Social Security check. Okay, if you're not, you'll get billed. There's also a deductible of $288. So the first $288 of Part B expenses are not covered by Medicare. And then afterwards, you pay 20%. So here is sort of how 4 ways you can handle your Medicare. You can have original Medicare and a standalone Part D plan for your drugs, which means that you must make sure you're enrolled in Part B of original Medicare, B as in boy, and that you have a standalone Part D plan. You can also buy a Medigap, a Medicare supplement plan. That is a plan that pays for some or all of the deductibles and co-pays Medicare has. You can have a Medicare Advantage. It says with or without prescription coverage. About the only people I think of who might think about having it without the prescription coverage are people like veterans who can get their drugs through the VA. Okay, you gotta have some way to. You gotta be covered by some plan for your medications. It could be a standalone Part D, or if it's Medicare Advantage, you can take if you get coverage for drugs, it has to be the one that's part of your Medicare Advantage plan. Do not try to connect Medicare Advantage and a standalone Part D plan. Bad things will happen. I won't go into detail because I want to get through this, but you don't do that. And then there are people who have TRICARE for life if they've made serving in the armed forces a career. They've got VA, retiree or employer sponsored coverage. Those are becoming less and less common. But that means you don't have to worry about any of this. You just go with the plans that are offered by your employer. Okay, Medigap policies. Everything I'm talking about except Parts A and B is done through insurance companies. It's not done through the government. Okay? If you're interested in Medigap policies, talk to us. We can help you see if you're eligible. Now, okay, this summarizes some of the advantages and disadvantages. Original Medicare, you can go see anybody who has a, who takes Medicare. Medicare Advantage, you've got networks that you either are encouraged or highly are required to go through. Okay, how do you get into Medicare? If you're collecting Social Security, you're enrolled automatically. You can call us or go online to the Social Security site and sign up. Now, when can you sign up? You can sign up to 3 months before your 65th birthday, the month of your 65th birthday, or 3 months afterwards. So you got 7 months to sign up. If you sign up ahead of your 65th birthday, coverage begins on the first day of the month in which you turn 65. If you sign up during your birthday month or during the 3 months afterwards, it begins on the first day of the month following when you sign up. If you miss your enrollment period, then you can sign up any time during the first 3 months of the year, and coverage begins the next month. Okay. If you sign up late, there are penalties. And I won't go. What if I am still working? Everything I say about the 65th birthday generally applies to the date that your coverage by your or your spouse's active employment. You know, when I 65, you say, when I or my spouse stop working.
Isn't it up to 9 months, if you, for whatever reason, I think they call that a change of circumstance or something like that, where you retire or lose your insurance and you're older than 65?
It's 8 months.
8 months, okay.
Okay. Okay, who's pays first? If you enroll in Part A, because it's free, 65 and later, you want to enroll in Part B, that's the only thing that can't be done online, okay? You have to get a form from your employer, you have to fill out a form and send it to Social Security. Okay, if for some reason you have a health savings account, that's closed off to contributions when you go on Medicare. Again, you can delay Part D while you're working, but you only have 63 days to sign up for that after your coverage stops. Always keep records of your health insurance coverage. You know, talk to people, write down who you spoke to, when you spoke to them, the result of the conversation. And read your mail. You know, please, keep your mail. It's really heartbreaking when I talk to somebody and they say, oh yeah, I think I got something about that a couple months ago, but I threw it away. I go, you know, you gotta keep on top of the mail you get for both Medicare and Medicaid. Retiree health plans almost always assume that you're enrolled in both Part A and Part B. They add on to that. They build on that. They're not in place of that. Big exception, people who work for the federal government, okay? I'm not gonna go over that, you're not getting charged, okay? This is if you have an gross income of $106,000 on a single return, or $212,000 on a joint return. I don't think there's many people here, including me, that have to worry about that. Okay, you can switch plans during open enrollment, which we're in the middle of, ends December 7th. For those of us on Medicare, we're probably the last generation that doesn't have trouble remembering the date December 7th. So, but all the decisions you make take effect with the new year. However, if you are enrolled in a Medicare Advantage plan, you can change it during open enrollment, or you can switch from one Medicare Advantage plan to another during the first 3 months of the year.
I have 2 questions about Medicare Advantage, which I thought of. I'll tell you the both.
Okay, let's say, let me get, okay, special, talk to us, if you start Medicaid, if you lose Medicaid, if you move, unfortunately you don't reside in an area with a 5-star plan, or losing or dropping other non-Medicare coverage, like coverage from employment. Okay, Medicare.gov website. It has incredible amounts of information, and it's really good. What I recommend is that you log in and have your Medicare card with you, and you create your own, they call it a MyMedicare.gov account. And then you can put in your medications. It will show you the cheapest Part D plan. It will help you pick a Medicare Advantage plan. You can, you can see what plans there are in your area. You may not want to go with the cheapest drug plan. You may want to pick one that's a little more, but where you go to get your medications filled is a preferred pharmacy, and so you don't have to change where you go. Almost all Part D plans have a sweetheart deal with one or more chains of pharmacies. Some are with Walgreens, some are with Walmart, so different ones, some with CVS. So take a look at that when you're choosing. Okay, these are all things that help people with low income and or low assets to, pay for their medical care, for their health insurance. Okay. For those on Medicaid, nothing is changing about Medicaid right now. There are a number of things that are set to hit in 2027, 2028. So watch this space, okay? Make sure that you have the contact info for your case manager at the county assistant's office. Okay. If you suspect fraud, report it. You will get a list of all the payments made on your behalf, okay? If you see something that you don't recognize, investigate it. Okay, this is our Medicare hotline. It's the number on your card. Here's the state hotline, and we're done. Any questions?
Yeah, two quick questions about Medicare. Is it true that, let's say you're on Medicare Advantage from IDX or something, they can cancel you, just send you a notice saying you're canceled, and you're out of luck then? Is that
Not
true?
unless you don't pay your premium.
No, I'm talking about they just decide they're changing the way they.
Oh, they can say, we're dropping your plan.
Right, and then you're,
Then you gotta find another plan.
but can you find another plan? Are you allowed to?
Yeah, they don't, if they do that in the middle of the year, you have a special enrollment period.
Okay, and the other question is, with Medicare Advantage plans, would they be things like free membership at a gym or something? Or some kind of, maybe transportation for all I know? Doesn't it affect the pool of money they've allocated for you or something like that? And it can affect other things?
No, if they offer it, there are some things that are offered only to people who have certain conditions.
Okay.
So they may offer it, but you may not be eligible for it. Make sure you're clear about that when you're choosing.
Okay.
But no, there's no medical underwriting. That is
Okay, so if you get a gym membership, it's not gonna affect